uterus, and you can see the endometrium and the myometrium and the epimetrium. This is the fimbria, looks like a glove, and the yellow stuff is the ovary. And if you look down here, this is the cervix. Of course, this is the vagina. My favorite question is to ask the umbilicus or the placenta.
The brown is the placenta?
Yes. But I'll only ask one. I'm not sure where I'll stick it, or I won't ask any. We'll just see. Right? All right, so we'll have 3 stations with male and female pelvic regions. And of course, there's some big models that show some things. And I got these out just because they are also informative, and you get to see it in 3 dimensions, right? So who would go first, boy or girl? Who's first?
Girls are always first. Girl.
Girl first, all right? So I'll set the girl here, I mean the guy. Here's a girl, okay? These are the major structures, and then we'll come back and tell you which ones we're likely to ask. This is the common iliac artery. It's red. This is the external iliac artery. This is the internal iliac artery. This is the common iliac vein. This is the internal iliac vein. Excuse me, external iliac vein. This is the internal iliac vein. Got it? This is the ovarian artery and the ovarian vein. And hidden under there is an ovarian ligament. But you can't see it. A suspensory ligament it's called, right? But just for your information. All right. Well, I like to ask, here's the fimbria, just like we saw on the other model. The fimbria, the ovary, and of course this is the oviduct, also known as the fallopian tubule. Can you see it? The fallopian tubule. It's kind of red. Also known as the uterine tube and the ovarian tube. So it's got a lot of names, so it's super important. When you do a tubular ligation, that's what you're tying off. That fallopian tube. Oh, I'm sorry. All right, this is the uterus. This is the urinary bladder. Notice how the uterus sits right on top of the urinary bladder. So when you're pregnant, you always need to pee. Right? This is where the ureter enters the urinary bladder. And this white tube here is the ureter. Now there are ligaments down here, so let's introduce them. Let's see if I can remember them all. This one is the round ligament. This one's the ovarian ligament. This one is the broad ligament. Stretches out all here. And this one is the uterosacral ligament. There are 4 ligaments on one side, and there are 4 ligaments on the other side, and they hold the uterus suspended in space. Let's look at the female and see how well they illustrate those. So this would be the uterosacral ligament. This is the broad ligament. This is the ovarian ligament. And this is the round ligament. And you've got them on this side. Round ligament, ovarian ligament, broad ligament, and uterosacral ligament, all holding on to the uterus. Because as it gets larger, it's going to want to move, so you got to hold it in place, right? All right, let's go through this. This is the symphysis pubis, the pubic bone. urinary bladder, uterus, vagina, and this is the rectum. This is the external anal sphincter. There are two glands here. This is the greater vestibular gland. The greater vestibular gland, and this little guy is the lesser vestibular gland. Both of these secrete mucus and things like that that keep the vagina moistened. And this, of course, is the clitoris. The clitoris, of course, is the same piece of tissue that becomes a penis in males. So when you flip it open, I usually don't ask on this piece. I see this guy did, but I usually ask on this half. From the internal, we can see the symphysis pubis, the mons pubis, the clitoris, which is labeled 4, the labia minora, and the labia majora. This is the feminine urethra, urinary bladder. This is the vagina. This is the cervix. And of course, this is the uterus. You can see the myometrium. This is the external anal sphincter. It goes around and attaches here. And then this is the internal anal sphincter. This is the rectum.